Hi, I'm Dr. Stephen Kopit, plastic surgeon at Mangat Plastic Surgery in Vail Valley, Colorado. This is Lindsay, who's one of our surgical techs, and today we're going to be talking about sizing for breast augmentation. So the question we always get asked is, how do I decide what implant I'm going to use, and how do I decide what size I'm going to be at the end of the procedure? I think patients are sometimes really reluctant to talk about breast augmentation because they feel like there's a loss of control, that they're going to have to wake up and see what they look like, and they want to know what kind of input and control they're going to have over the process. So this is how we do it. After doing a real brief physical examination, start by talking to the patient about what their expectations are. And usually that's framed in an I'm a B and I want to be a C, or I'm a B and I want to be a D. And we have to somehow translate those desires into cubic centimeters of breast volume, because that's how implants are measured. And obviously a 34B is smaller than a 36B, which is smaller than a 38B. So all those things, we have to translate all that into what size implant are we going to put in, and this is how we do it. So implants come in different shapes and sizes, and we're not, I always tell patients, we're not artists, we're artisans, we're craftsmen. We have to build, it's like building a cabinet, and the cabinet has to fit the wall. So there are dimensions of the breast that we have to work within. If we have an implant that's too wide, it won't fit the space, and the implant might be sticking out too far on the side or too close together in the midline. If the implant's too small, the implant would be swimming around in the pocket. And so we need to make sure that we're picking implants that are generally going to fit the patient's breast anatomy. And one of the ways we do that is these implants come in different shapes. So most augmentation, we're going to have round implants. They're usually smooth implants. And there's three basic shapes. So there's what we call a moderate classic, which is going to be a wider, flatter implant. There's an in-between, which we call a moderate plus implant, which is going, if they have the same volume, is going to be more narrow and have more projection, and then there's going to be a high-profile implant. So I'm able to adjust the shape of the implant to fit the patient's breast anatomy, how wide their chest wall is, and based on what volume we want. So assuming that we're just talking about breast augmentation, which is just a pure volume change, we're not talking about doing lifting procedures, that's for another day, we usually have patients start out to try and help us figure out how we get from A, B, C, D to cubic centimeters. We have them try on sizers. So Lindsay usually spends a lot of time with patients in the room trying on sizers, and the idea is that these are not real implants, but they're designed by the company to mimic ballpark what this volume, putting it in a bra and trying it on in the office, how close that would get to what is a round implant inside the patient's anatomy. So we start out, Lindsay and I have to frame for the patient sort of a ballpark range of implant sizes that we think we could make fit and have a natural looking shape and size. And then we try to work with the patient to help figure out within that range, the highest number we think we could put in and the lowest, where that patient wants to be. And the idea is the patients are going to try on implants and look in the mirror and try and get a feel for what size looks desirable for them based on their shoulders, their height, their hip width, their waist, and try to come up with what's too big. So there's always a lot of talk, usually buzzing around the internet, that everybody wishes they think when they wake up they should have been bigger. I don't think that's our experience, because if we identify for you, if Lindsay identifies for you, trying on sizers, what's too big, what was uncomfortable in terms of your appearance, and we can just put in something just less than that. And then we sort of know that we put in the largest implant that the patient's comfortable with, that's in the range that we designate, that we think will give a real natural result. You want to tell them a little bit about when you're trying on what you're talking about? Because I'm usually not in the room at that point.
So we have you put this tight, they're always tight, kind of uncomfortable, this white bra on, and what we do is we start slipping in the implant sizers into the bra and kind of mimic the size that you would like to be. I've had patients who are marathon runners, who want to put the bra on with the sizers in, and they want to jump and run around the office to see what they will feel like, which is totally appropriate. I've had people bend over to see the weight, to see if they're going to feel the weight on their shoulders using the bra as well. And we kind of just slowly work our way up. I'll put in, like, this for an example is 150 cc's. If Dr. Kopitz says our range to try on is anywhere from 200 to 350, we'll put the 150 in, and then there's another little 51 that I'll slip in, and we'll slowly work up to the sizes. We have big body mirrors, so when you're standing in the room with your bra on and the sizers, you can turn side profile and see the breasts in the bra to get an idea of what you will look like post-surgery.
Do you have them put on clothes too, so they get an idea, or is it just...
Yes, if you would like. I feel like most women just trying on the bra, they get an idea of what it'll look like. I've had a few patients want to put on a tank top to kind of get a better feel, and I had one patient bring in a bathing suit, and we slipped the sizers into her bathing suit instead of the bra.
And another way to refine that at home is cubic centimeters of volume is also the same as milliliters. So patients can use a measuring cup at home, and we give them sort of the ballpark parameters, and you can use rice and in a measuring cup and put it in a sandwich bag and do some work, some analysis for that at home, because that obviously gives you your closet, and you can try on different outfits and figure out what volume works with your suit that you wear to work, or depending on what you do, if you're wearing yoga tops. So it gives people a chance to try on some different outfits and try and help fine tune that, with the understanding that it's still our job in the operating room to make sure that the implant's going to fit and give you a natural shape. So usually within one size up or down of the patient's expectations, we sort of have a little bit of leeway, because the way we do the surgery is the patient's asleep on the operating table, we make a pocket, and we have sizers, which are temporary implants that we can put in, sit you up, make sure the pocket's right, try perhaps a different shaped implant, to try and make sure that we're getting sort of the optimal shape, and then we can put in an implant. We have, obviously, all the cabinets are full of implants, and we can just take 2 implants and put in the appropriate size. So we do have a little bit of making sure it fits at the time of surgery, but usually we get, if not the exact size the patient thinks they're going to get, we're usually a shot glass above or below that. Do you have any questions that come through so far?
No, you've addressed so much.
Okay. The last thing we talk about, silicone and saline. The bottom line is all implants have sort of the similar complication profile, which is putting something foreign in the body. It's not really critical what's inside the implant, what we call the implant shell. Obviously, silicone, the reason we use it is because the stuff inside is thicker. It's a little, some people say it's like a gummy bear. If I sliced it, it would just sit here, it wouldn't run off the table. Saline is obviously the salt water that goes into your IV. The difference really between the two for most patients is that if a saline implant were to rupture, the shell would break, you would absorb the fluid, and the breast would be flat. Silicone doesn't go anywhere. So the diagnosis of whether there's a rent in the shell of the implant is usually made with an MRI. So there's some conversation at the time of your consultation as to whether you want to use saline or silicone. Most of the time we use silicone. Once you go through the differences between the two, most patients are going to choose the silicone implant because it's going to feel softer, it's going to lay smoother, and it's going to look more natural. It also has less what we call, most patients call rippling, we call fold flaws, which is, you can see when you take an implant, you turn it on its side, it has a tendency to have some of these ridges. Saline implants are going to do that more. So especially for patients who are very small chested, there isn't very much covering the implant, this implant's going to look more like tissue and less like an implant under the skin. So for most patients, we're using silicone implants, and there's obviously a long conversation at the consultation about the pros and cons of silicone and saline, and the risk profile. So most patients know which one they're choosing. You know going into surgery which implant you're using.
Okay, and we have received a few more questions. So the first one, how long do implants last?
So there's a lot of information on the the internet, which is frustrating because a lot of patients come in thinking they have to change their implants out every 10 years. The truth is that for this implant, this smooth round implant, the rupture rate's about 5% at 10 years. So really only 5 out of 100 implants have to be changed at 10 years. Obviously, if we were changing everyone's implants every 10 years, we'd need 10 more doctors working here. So the way you do implants evaluation, the FDA recommends that you get a screening MRI every 3 years, or at 3 years after the implants are placed and every 2 years after. There's some pros and cons to doing that routine screening, which we talk to patients about, but the vast majority of implants will last a patient's lifetime.
Wow. The other question we got is, how do you know what type of profile is best for you?
Okay, so let's just say, Lindsay, for instance, wants a 350 cc implant. So we've decided, trying on sizers, that 350 is kind of where she wants to be. So my job is, a lot of people think the shape of the implant determines the shape of the breast. It's actually the opposite. So let's just say I'm going to use a 350 cc implant. This implant at 350 cc's may be too wide. So it might be too close to the midline. It might stick out under the arm. So my choices then would be use a smaller implant, which obviously would be less in all dimensions, or switch to a narrower implant that's going to have more projection. So frequently we adjust the shape of the implant to get the volume the patient wants to fit inside the patient's dimensions. So if you wanted a large implant and you're relatively narrow, the only implant that's going to fit is going to be a high profile implant. So really the shape of the implant in terms of projection and width is kind of determined by what volume we're trying to fit into that patient.
Okay. And another question we got is about breastfeeding. Breastfeeding after implants, are the implants going to create a problem for that?
No. That's the simple answer, is that you can breastfeed after having implants. There's no evidence that the implant will affect breast milk or affect your ability to breastfeed.
Okay. We don't have any other questions at this time. Do you have anything else you want to add?
No, I think that about covers you. Anything for you?
No. Ladies, it's free consult. So if you ever dreamt about having larger breasts, give us a call, make an appointment with me today, and let's try on our bra and jump around in the office.
Okay, Mangat Plastic Surgery Institute and Skincare in Avon, Colorado. Our website is mangatplasticsurgery.com. Our phone number is 970-766-3223, and we have one last minute question I want to put in there. Recovery time.
So recovery time for breast augmentation, surgery happens right here in this room. We have two fully set up ORs here. You go home that day, you have a wrap on like a tube top. We inject a numbing agent along the chest wall so you're pretty comfortable for the first day or two. You take the wrap down day and a half or 2 days after surgery. Usually patients come back to the office, we do it for you. All the stitches are under the skin, there's tape on the incision, you're showering, wearing a sports bra, and you can do essentially anything you feel up to except upper body heavy lifting. So you can ride a stationary bike, you can power walk and increase it to running based on your comfort level. Most people that's going to be a week or two. Most people are driving within a few days, back to work within a week for a desk kind of job. We get asked all the time, when can I ski? Some of that depends on how hard you ski, but we usually say about 4 weeks. But for hiking and all the things we do here, riding bikes, it's usually a week or two based on your comfort level.
Okay, great. Thank you very much.
Thanks, everybody.